Day 25 of Learning Exercise Therapy. A patient in a Phase 1 cardiac rehabilitation program begins walking with assistance. Which following monitoring techniques will not be necessary in a Phase 1 program? Answer: electromyography. A therapist completes a developmental assessment on a 5-month-old infant. If the therapist elects to examine the infant's palmar grasp reflex, which of the following stimuli is the most appropriate? Answer: maintained pressure to the palm of the hand. Secretion removal techniques are an integral component of a pulmonary rehabilitation program. What is the simplest method to clear secretions from the upper airways? Answer: cough. A therapist instructs a patient to expire maximally after taking a maximal inspiration. The therapist can use these instructions to measure the patient's answer: vital capacity. A therapist instructs a patient in diaphragmatic breathing exercises. Which of the following instructions will not be helpful in teaching diaphragmatic breathing? Answer: as you expire, watch your lower hand rise. A therapist volunteers to assist participants at the finish line in a 10K rod race. The race takes place on a hot and humid day, and some of the race organizers are concerned about the potential for heat-related disorders such as heat exhaustion and heat stroke. The most significant variables to difference between heat exhaustion and heat stroke are: answer: mental status and skin temperature. A therapist monitors patients' vital signs while exercising in a Phase 1 cardiac rehabilitation program. The patient is status post-myocardial infarction and has progressed without difficulty while involved in the program. Which of the following vital sign recordings will exceed the typical limits of a Phase 1 program? Answer: systolic blood pressure decreases by 20 mmHg from resting level.